All right, so when does dad get poked with needles? Mom's had all the bad stuff. So really all adults in contact with babies should be vaccinated against pertussis, which is whooping cough, if able. In case you're not aware, there has been an outbreak of pertussis, particularly out west. It's for a combination of reasons. One of them is vaccine refusal, but the other is that we as kids got our DTaP at 5 years old, and then that immunity wears off. So we've got this whole generation of adults and teens walking around who are not immune to pertussis. And if you pick it up, who you're going to give it to but an unvaccinated baby? So newborns get into really big trouble with pertussis. I, as a resident, had a baby, got it from mom, got pertussis from mom, came in and ended up on heart and lung bypass from it. And mom just thought she had a cold, unfortunately. So get your Tdap vaccine if you've not already. Dads, you can do it now. Moms, you gotta wait until delivery, and they will likely offer it in the hospital. I don't know if we do here, but we do at Women's for sure. But you wanna ask for Tdap. The P is pertussis, not TD. We do still have the one without, so you wanna make sure you're getting the right one. So the flu is the other shot that I want everybody to be thinking about. Influenza does kill Americans every year, and children under 2 are at the highest risk of anybody. Anyone in contact who is able to get the vaccine should, and the vaccine is out and available now, so now is the time to be thinking about it. My favorite excuse for not getting the flu vaccine is we don't get sick. Which is luck, not skill. So really think hard about getting the flu vaccine, because a 1-month-old is going to end up in the hospital if they get the flu from you. Should I take baby's temperature? So yes, you should if baby feels warm or something is going on. If everything's okay, you don't need to be taking baby's temperature every day. Under the arm or axillary temperatures are acceptable as a starting point. They do run a little bit lower than core temperatures, but people are usually more comfortable with that type of a temperature. If you get 99 degrees or higher under the arm, I would consider a rectal temperature. This is something to discuss with your doctor. Some doctors aren't comfortable having patients take rectal temperatures, but they definitely are more accurate. At all costs in newborns, I would avoid ear, forehead thermometers. There's all kinds of gadgets out there. When they are tiny, the difference of half of a degree makes a big difference. So you really want the most accurate possible temperature. So what is a fever? 100.4 is a fever. Fever in a newborn baby is a medical emergency, and you need to go immediately to the emergency room for the first month, and probably longer than that. This is something you want to ask your doctor about at the first visit. You want a fever plan. Until what age would your doctor like you to go to the emergency room versus coming to the office, and which ER would they like you to go to? Those are important questions to ask. All right, so some tips on communicating with baby's doctor. If you can, avoid using medical jargon unless you know what it means and you're sure about it. We always prefer that you use your own words. We don't mind words like gooey and stinky and snotty, that's fine. Frequently misused words are wheezing and lethargic. Those are classics, and you may not be talking about the same thing that your doctor is imagining. So make sure that you use words that you're comfortable with. Lethargic, by the way, to a doctor means nearly in a coma. And I've had people explain that their child is lethargic while they're tearing up my exam room. So, we may not be having the same conversation if you're not using words that you're comfortable with. If something concerns you and it comes and goes and it's intermittent, take a video. We don't mind watching videos on your phone, seeing pictures taken at home, that's fine. And then when it comes to reporting temperatures, do not interpret the baby's temperature by adding, subtracting, square roots. Just give us the number and how you got it and when it was, that's it. Okay, some pictures of some fun things you're probably gonna see. This is a classic baby rash that happens to approximately 50% of babies, so probably gonna happen to half of you in this room. It's called erythema toxicum, and it looks literally like your baby got bitten by a bunch of fleas. And it's a very odd rash because it moves around quickly. You'll call the nurse to come and see it, and then it will be gone or move. And it usually lasts maybe a week or so, and then it just goes away. Nothing to do for it. This is neonatal acne. Again, we're going to blame mom's hormones. And typically sets in right about the time you schedule your newborn portraits, 2 to 3 weeks of age, and can last weeks to months. And there is nothing to do No proactive, oxystridex, it will go away by itself. These are called Mongolian spots. This is a very common birthmark. They're not usually this dark, but this is just helpful for demonstration. They look very much like bruises, and they are commonly on the buttocks and the back. They can be anywhere. I've seen them arms, legs. I've even seen them on the face. And it's good to be aware of it, and anybody that's taking care of the baby should be aware of it, because I can see where it would be confused for bruises easily if you didn't know. So they do fade usually over about 2 to 3 years, and it's normal. This is Accra Cyanosis. I don't know how well you can see in the first picture here. The feet here are a little bit bluer than like the belly up here. And you can see over here, these toes are pretty blue. It's kind of it starts resolving on this part of the foot, and you can see the toes are still blue. So, you know, newborns don't have great circulation to their hands and feet. And so if you see blue hands and feet in the first few days, that's okay. Blue lips and tongue, not okay. So this is Spit-Up. The one on the left, the yellow one here, that is Colostrum Spit-Up. So the beginning of your breast milk is going to be like a neon yellow color, and that is normal. And as long as it's not excessive, that's okay. The Spit-Up over here on this side, this green, is very abnormal and needs to be seen right away. Bring the blanket with you, take a picture of it. Your doctor needs to know you're not kidding if that's what your Spit-Up looks like here. That's not normal. That's bile, by the way. These are common newborn birthmarks. So they're just vascular birthmarks, and they usually will fade over a couple of years. When they're on the eyelids, like on this baby, people call them angel kisses. People call them stork bites when they're on the neck, like that. These are called Epstein Pearls, those little white things on the roof of the mouth, the hard palate here. And it's normal. Most babies have them, but it's commonly confused with thrush, which is a yeast infection in the mouth. If you have thrush, you're going to see little white spots all over the inner cheeks, the gums. It's going to be more than one spot on the roof of the mouth like that. This is normal newborn peeling. This drives parents crazy. There is really nothing you can do. You can moisturize until the cows come home. They're going to peel, and it's okay. If you want to use some moisturizer, it's not going to hurt. Just make sure to use a very gentle, unscented one. Sebaceous hyperplasia, these little yellow spots on the nose, again, mom's hormones, and it does resolve on its own. And these are pictures of some babies that had a rough time coming out. This is some eyelid swelling over here. That is common, and it does resolve by itself. This is some pretty bad facial bruising, but you would be amazed. Babies that look like this often are back to normal within a day or two. So it's pretty quick. This is a subconjunctival hemorrhage, this little red area here. It's basically broken blood vessels in the white of the eye, and it's just from pressure on the way out. It is common, resolves by itself. There's nothing to worry about. Doesn't affect the baby's vision. So to call or not to call? People who ask me this question are really usually asking me, how can we not be those people? I would suggest that you find a reliable book on caring for infants and run it by your pediatrician. Just say, look, this is kind of what we were thinking about using. How do you feel about it? And you know, it can answer a lot of those simple questions that you don't really want to call about. If something cannot be easily diagnosed on the phone, my advice is to make an appointment and go in. Don't wait for a call back. We sometimes get busy in the office. It may be a couple of hours if something is non-urgent. And by the time I get back to you to answer your question about the rash that I can't see over the phone, you probably could have been in and out and been done already. So yeah, rashes, not real good at that on the phone. So make an appointment. If you're unsure, just always err on the side of calling. It's what we do. It's what we get paid to do. If you have a question, call. When in doubt, the bottom line is take baby to see his doctor. We would rather that you came in 25 times when you didn't need to come in than stay home the time that you did need to come in. They don't come with instruction manuals. We know that you aren't going to know everything at first, and it's normal. And just come in if you're just not sure. It's okay. If it can be handled by phone, then call. If you know that it can't, again, rash is a great example, go in. And in the end, trust your gut. I think that sometimes new parents think it takes a year to acquire that parent instinct. It doesn't. You know right away when something's not right, and trust your gut. Most importantly, just relax and enjoy your baby. Time goes fast.